First responders may be getting a new tool for medical emergencies. The contact list in your cell phone could become more than a convenience. It could save your life. ICE, or in case of emergency, is an initiative to help first responders gather information about victims. The program asks people to put an emergency contact number under the acronym ICE in the phone book on their cell phone. That way, first responders like paramedics or lifeguards can call to get important medical information. Lisa Liston is a lifeguard and the aquatic director of the Fredericton YMCA. She says the ICE program could become invaluable.
If I could get a hold of that emergency contact fairly quickly, they could tell me, yes, this person's allergic to, I don't know, bee stings, and they have an EpiPen in their backpack. Then I would know to go into their backpack, look for the EpiPen, and then I would be able to give them the EpiPen, which would then give that person a few more minutes to live while the ambulance arrives. So it really could be life or death.
The ICE program stemmed from the terrorist bombings on London in 2005. Paramedics there had difficulty finding emergency contacts and decided a better system needed to be in place. It quickly grew popular throughout Europe and is now reaching across the pond. With the vast majority of North Americans carrying cell phones, many first responders see this as the most effective way to reach emergency contacts. Here's what Fredericton citizens think about ICE.
Yeah, it's a good idea, just in case you don't have your ID on you, and they know who you are and who to contact, because if you go to the hospital without ID, they don't know who to call, I guess. Tons of people have cell phones, so I don't see why not. If they download music on their cell phones, chances are they're going to want to do this too.
It's a fine idea. I have a cell phone, and I don't have anything like that on it. I think that added to it would be great. Somebody sees you in trouble, and they would know where to contact. So, yeah, I think it's a good idea.
John Nicholson is the Director of Emergency Medical Services for River Valley Health. He says the biggest challenge with ICE is its implementation.
The issue would be getting the public online for it. It would be a very simple thing for them to punch that in as one of their contact numbers would be in case of emergency contact. Whoever it is, their mother, father, husband, wife, and so on. And that would allow for people to be able to contact them in the case of emergency and would certainly speed up the process. And the other piece to that would be to make aware to the first responders and the emergency room staff that this has been done so that they would know to look for a cell phone and then look for that number.
Nicholson said there's no official plan to implement ICE yet, but he does want to see it happen. He feels that with advertising and education in schools, the program is bound to catch on. Both he and Liston feel it's too valuable a tool not to be used, because when it comes to saving lives, time is always of the essence. For Sioux Journalism, this is Kyle Mullin reporting.